Hi, my name is Caitlin Dale and this is video 13, surgical site preparation. Today I'm going to get all my equipment ready for today's procedure. So I have my examination gloves here, I have my vacuum, and I also have my clipper blades. I am going to check that these are clean, that they do have the right blade attached, and that they are operational. So this is really important as clippers can nick the skin. They can also cause clipper rash, and this can possibly lead to surgical site infections. So really important there. Now I am going to make up my fresh skin antiseptic solutions for the skin preparation. So step one. This is where we use the chlorhexidine gluconate 4% scrub solution. So we pretty much use this undiluted. So I'm going to pour this into my scrub container here. We do add a splash of distilled water just so that it is easily lathered up when we are using the gauze on the patient. Step 2 is the rinse. So in clinic here we use a 70% methylated spirit. So this already comes pre-prepared in big tubs, and then we decant out into smaller spray bottles for ease of use. And then step 3, this is the paint. So in clinic here we use a chlorhexidine gluconate 5% concentrate solution. So to make up a 100 ml chlorhex meth solution, we use 10 ml of the chlorhex gluconate 5% concentration solution. We then use a 15 ml of distilled water, which is 25 ml, and then we use methylated spirits, so 75 ml to make it up to a 100 ml solution. In both of our scrub and our final paint solution, we use soft non-linting gauze swabs. So I'm going to pop some of these into the solution today for my patient. Today we have a ovariohysterectomy. I'm going to clip my patient from the xiphoid process, so just around that sort of underneath the rib area, down to the brim of the pubis. I'm then going to extend laterally, 4 to 5 centimetres either side of the teats, depending on the size of the patient. Caitlin Dale, resuming video 13. So I am clipping my patient here. I have already half pre-clipped. I'm going to hold my clippers in a pencil grip here, and I am going against the grain of the fur here so I can get as close as possible, and holding the skin taut where necessary. Once I have finished clipping, I do just need to check the vet that the margins that I have clipped today are okay. Now that I am happy with my clip, Dr. Danny, do you mind just checking you're happy with my margins here?
Beautiful.
Lovely. So now I am going to tighten up all the loose hair. So patient bench and all the surrounds. Now before I scrub, I am going to wash my hair real quick. the incision site and go back and forth motion, and for around 15 seconds. Let me start my swab. I'm just going to slowly work my way out from the incision site, and then never working my way back in, always incision site out. They're going to hear you speak, right? Okay, so now I am going to use my breath method, spray my wrists, spray all over until all visible suds have been removed. And give it a little bit of time to evaporate so it can do its job. Today just to help prevent any contamination getting onto that prepped area here. I do just need to now change my gloves. So I am just popping on my gloves
and then I will repeat that scrub process, the final paint process again with the 4 hex method, and then the same pattern as before. So the 4 corner technique and incision side out. Is now all prepped for surgery, and I can remove my gloves and wash my hands.